before I start explaining some of this material, I will first introduce myself. My name is Amelia. I'm from class 2-1. In this English course, there are 15 material, and I will explain all of them briefly. Okay, let's begin. Okay, the first material is about admitting patient. Admitting patient is a series of process for admitting patient to revise service in an inpatient unit that are tailored to the needs of patient at inpatient admission. The process of admitting patient at the hospital. Inpatient admission process can come from outpatient service or from stable emergency patient service. The objectives of admission service include improving the provision of information to patient and families, creating an orderly admission, and proving medical record files and clarifying data on patient who will be admitted to the hospital. With the admission process at the hospital, it is hoped that patient and families will get explanation about general consent, right and obligation, patient privacy, financy, and other things that patient need will be tried in the hospital. Procedure and arrangement for inpatient and discharge procedure are very important in order to improve the quality of patient care in all sectors of hospital service. Patient care approach the aim to improve quality and provide the sentence of justice. Okay, the procedure. There are two types procedure, and the first, patients are admitted from outpatient care. First, registration, and then examination at the outpatient installation. The next, patient service admission notes, inpatient order from the polyclinic doctor. 4. Patient or families of patient go to the inpatient registration place to register for inpatient care. 5. The patient cite the general consent. And next, the patient gets a room, and then the patient is escorted by the officer to the inpatient room. The type 2, registration, and then examination at the IGD. 3. Registration at the IGD for the patient service and admission notes or letter of inpatient order from the IGD doctor. 5. The patient or patient's family goes to the inpatient registration place to register inpatient. 6. The patient cite the general consent. The patient gets a room. The patient is escorted by the officer to the inpatient room. And then the second material is about, you can watch role play videos about hospital admission procedure. Where there is a dialogue between nurses and patient who will seek treatments or consultation at the hospital. And also in this material, you can practice the dialogue admitting patient in the video about admitting patient. And here is the admitting patient roleplay video link that you can watch. Okay, the third material, caring patient after an operating, or we can call post-operative care. Post-operative care is the care you revise after a surgery procedure. The type of post-operative care you need depends on the type of surgery you have, as well as your health history. It often includes pain management and wound care. Post-operative care begins immediately after surgery. It lasts for the duration of your hospital stay and may continue after you have been discharged. Prepare ahead of time, ask many questions as possible before your surgery, and ask for update in instruction before your discharge from the hospital. The answer to this question can help you prepare ahead of time. If you expect to need help from a caregiver, arrange for it before your surgery. It's also important to learn how to prevent, recognize, and respond to possible complications. Depending on the type of surgery you have, there are many potential complications that can arise. Post-operative care in the hospital. After your surgery is complete, you will be moved to a recovery room. You you will probably stay there for a couple of hours. Will you wake up from anesthesia? You will feel groggy when you wake up. Some people also feel nauseatic while you're in the recovery room. Staff will monitor your blood pressure, breathing, temperature, and pulse. They may ask you to take deep breaths to assess for lung function. Outpatient surgery is also known as Sunday surgery, unless you show signs of postoperative problems. You will be discharged on the same day as your procedure. You won't need to stay overnight. Before you are discharged, you must demonstrate that you are able to breathe normally, drink, and urinate. Uh, Inpatient surgery. If you have inpatient surgery, you will need to stay at the hospital overnight to continue revising postoperative care. You may need to stay for several days or longer. In some cases, patients who were originally scheduled for outpatient surgery show signs of complication and need to be admitted for ongoing care. Your postoperative care will continue after you have been transferred out of the initial recovery room. You will probably still have an intravenous catheter in your arm, a finger device that measures oxygen level in your blood, and a dressing on your surgical site. Depending on the type of surgical you had, you may also have a breathing apparatus, a heartbeat monitor, and a tube in your mouth, nose, or blender. Post-operative care at home, it's very important that you follow your doctor instruction after you leave the hospital. Take medication as prescribed, watch out for potential complication, and keep your follow-up appointment. Don't overdo things if you have been instruction to rest. On the other hand, don't neglect physical activity if you have been given the go-ahead to move around. Start to resume normal activities as soon as you safely can. Most of the time, it's best to gradually return to your normal routine. Takeaway: approach follow-up care can help reduce your risk of complication after surgery and support your recovery process. Ask your doctor for instruction before you have your surgery and check up update before you leave the hospital. Okay, the full material. You can watch role-play video about caring patient after an operating or post-operative care, and you can try to present material about post-operative care, patient handling, or caring patient after an operating or post-operative care. Decide on videos that have been watched previously. And here is the caring patient after an operating or post-operative care role-play video link that you can watch. The fifth material is caring terminally ill patient. The following are 4 ways in which a clinical can be helpful to a patient who is terminally ill patient. The first is the physiological and spiritual coping process. The consultant can engage in this discussion that allow the patient to reveal the important physiological, social, and spiritual aspect in his or her life. And in an article that discuss an of-life care, describe that a systemic assessment of this dominant allow therapists to gain a sense of the patient coping traits and vulnerabilities, and to assess and treat psychiatric illness. Psychiatric illness is common in patients with terminal illness. The disease should be identified as a treatable syndrome, not as the expected outcome of a terminal diagnosis. Mental status check and careful monitoring of the patient level of consciousness, orientation, and agitation through the day can help identify delirium in this population at risk. Then when delirium is diagnosed, the cause of the delirium must be determined. It is very important to distinguish between irreversible cause of delirium and treatable causes. Treatable causes of delirium in this population include, but are not limited to, the contribution of drugs, reduced electric dystrophis, metabolic disorders, and infection, as well as those that can contribution to a disruption of mental status. The three, the maximizing comfort. In, in addition to diagnosis mental illness, the consultant must also look at other factors that contribution to patient comfort disorder. A psychiatric consultant can assess the care team with identify ongoing pain. The consultant can remit the time of treatment that much higher dose or narcotics are needed in chronically ill patient with acute patient. A consultant can also eliminate the education on in people who are seriously ill. In that it can provide reference regarding adequate food, drink, and care, and can significantly improve mood, self-esteem, and diagnosis. In addition, the patient physical location can have a treatment impact. Those this person want to die at home or in the from of the hospital in the hospital. Each of these factors need to be taken into account in terminal patient care. The four, treat and family member. Physicians who treat patients with terminal illness undergo significant stress. They may feel helplessness at their inability to care the patient or aim at themselves for not catching the illness at an earlier stage. Conversely, street can feel their dose give with the loss of patient with whom they have had a long relationship or a strong alliance. The psychiatric consultant can help treats to identify their gift and can urge them to share this feeling of loss with the patient, with other colleagues, and with superior. The psychiatric consultant can also help family member cope with the impending loss of a loved one in considering the emotional stage of a person with terminal illness. It is often helpful to consider the effect of the family member on the patient and vice versa. By observing the interaction for the patient with family, the consultant can become aware of long-standing grudges or new difficulties in communication that can make the process of coming to closure at the end of a file more difficult. Okay, the sixth material. You can watch role-play video about procedure for treating serious ill patient or caring terminally ill patient, and you can try to present material based on videos that have been watched about procedure for treating seriously ill patient or caring terminally ill patient based on videos that have been watched before. And here is a video link for a procedure for treating seriously ill patient or caring terminally ill patient that you can watch.